I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. This vlog is about elder abuse. Any person who is more than 60 years old is considered as elder. According to World Health Organization, 1 in 6 over 60 years old experienced elder abuse last year. 2 billion people will be over 60 years old in 2050 as compared to 900 million people in 2015. It is a frequent problem, but it is hidden. Only 4% is reported. Men are more victim of elder abuse as compared to female. So what is elder abuse? It is an intentional act or failure to act by a close relative or caregiver who are usually trusted to more than 60 years old person. It is expected that elder abuse will be increased because now people live longer. It can lead serious physical and long-term psychological consequences. Due to the elder abuse, there is an increased risk of nursing home placements, use of emergency services, hospitalization, and deaths. So what are the common types of abuse? Financial abuse. So financial abuse is the illegal, unauthorized, improper use of an elder's money, benefits, belongings, property, or assets for the benefit of someone else other than the older adult who is holding all these things. Other most common type is a physical abuse. When an elder person experiences illness, pain, injury, functional impairment, distress, and in some cases death due to physical force such as punching, kicking, slapping, hitting, and in some cases burning as well. Sexual abuse. So what is sexual abuse? There are several types of sexual abuse such as sexual harassment, forced or unwanted sexual interaction of any kind, whether it's a penetrative or non-penetrative sex with an older adult, emotional or psychological abuse, verbal or non-verbal behaviors of any abuser that inflict anguish, mental pain, fear, or distress on an adult who is more than 60 years old. So examples are, these are very common examples like humiliating or disrespecting someone verbally in front of the family members, friends, or other members of the society, giving verbal threats, harassing someone, isolation, whether that is a geographical, interpersonal, or any kind of isolation against the will of elder who is more than 60 years old. Neglect is another very common type of elder abuse. So neglect is the failure to meet an older adult's basic needs. So what are the basic needs? So basic needs are not providing food, water, not providing living place, proper clothing, for example, winter clothes, summer clothes, not providing heating during the winter time, and if person is sick, not providing essential medical care or not taking to the hospital. So what are the consequences of elder abuse? There are some serious consequences. For example, physical injuries. In some cases, there are only minor cuts, scratches, bruises, or welts. but in some cases more serious cause of physical injuries and can cause long-lasting disabilities. So for example, head injuries, broken bones, broken ribs. So due to these injuries, if person is feeling constant pain and soreness, so that is a long-lasting consequence. Physical injuries can sometimes lead to premature death, and sometimes homicide is also reported. And due to these injuries, pre-existing health problems or underlying health issues, those problems get worse. Elder abuse can have emotional effects as well. Victims are often very fearful, frightened, anxious, and they have real issues with trust, and they are always wary around others. So how we can prevent elder abuse? There are several or different types of strategies to prevent elder abuse. There are robust strategies in the Western world, but in the underdeveloped countries, there should be some robust strategies to prevent elder abuse. The most important is make public and professionals, especially caregivers, healthcare professionals, aware of elder abuse, the different types of elder abuse, consequences of elder abuse. Do screening of potential victims as well as abusers. There should be school-based intergenerational programs. Provide support to the caregivers, including stress management and respite care. Implement residential care policies. There should be clear definition of elder abuse and how to provide a good or excellent standards, excellent care. So provide also training to the caregivers about dementia. There should be mandatory, in Western worlds, yes, it is a mandatory to report elder abuse to the authorities, so then they can prevent further abuse and they can save the victim. So there should be self-help groups. If any victim, provide safe house and emergency shelter to them, and provide all people who are more than 60 years old. So psychological programs for the abusers, so then they can be a functional and proper citizen of the nation. Provide helpline if there is any elder abuse, so that can be reported immediately and the authorities can take quick action. Thank you very much for watching this video. If you have any question, write down in the comment section. I will answer your queries, or you can contact me on my Facebook page, Dr. Nadeem Sajjad Khinger. Please do subscribe my channel and press bell icon button.